So we are a private medical clinic with a focus on genomic medicine. So we are located on the campus of a large biotech institute in Huntsville that has a focus on genetics and genomics. And the clinic was open with the goal of using whole genome sequencing technology to get a diagnosis for folks with rare, undiagnosed, or misdiagnosed diseases. Patients are folks who have been on the diagnostic odyssey. They may have been from doctor to doctor, they may have had lots of medical tests, may have had some genetic testing, and nobody has been able to figure out a cause for their disease. So they may have a symptomatic diagnosis or they may have a clinical diagnosis, but nobody's ever sorted out why has this happened. And so we order whole genome sequencing when appropriate. So reading all of their genes to try to find a change or mistake in their genes that explains their symptoms. So patients can come to the clinic and we see them do a full medical evaluation and then order whatever testing is appropriate. The other option for folks who can't necessarily come to Alabama is that we have on our campus the Hudson Alpha Clinical Services Lab. It's a CAP and CLIA approved laboratory that does whole genome sequencing and functions as a reference lab as well. So doctors from across the country and across the world can order testing from their patients. So, in some cases we see folks who have been through the entire process and they may have had, we'll take the example of a child, a pretty typical referral would be a child with unexplained developmental delay. In this case, I'm particularly thinking of a child who also had microcephaly. She had had chromosomes, a microarray, she had had a full biochemical workup, she had had some gene testing panels, and this whole process was stretching out over months and months. And we saw this patient and ordered whole genome sequencing for her, and now we think we've got an answer. Is it going to change a whole lot for her in terms of treatment and a cure? Not necessarily, but in these cases it provides an answer for the family so they can stop wondering why. It gives them some guidance on what to expect in the future. It can give them some information about what are the chances of this happening again in a family. There's a lot of personal utility there. And also it avoids the need for this child to be subjected to repeated tests over and over. Once you've got the answer, you can stop searching. You can stop having these invasive tests and drawing blood every few weeks and sending her to specialist after specialist and focus on what's going to help her to live her best life once we got that answer.